All right, so hi everybody, I'm Dr. Lisa Bachos. Thank you for the introduction, Sydney. I work in a couple of different settings at OSU under the physical medicine and rehabilitation department as a rehabilitation psychologist. We're going to talk a little bit about sexuality and relationships tonight. I'm gonna, since Kadar went over this, I'm going to remind everybody that this is kind of a two-part presentation. You're going to get quite a bit of information tonight, and then next week is going to focus a little bit more on actionable strategies. We are going to kind of survey you guys throughout and ask some questions at the end of where you would like to direct your focus next week to make sure we're addressing things that are on your mind. Today is designed to be more of a broad overview. We're going to talk about a lot of different information. There is quite a bit of content on the slides, and I want you to keep in mind that the slides will be available for you on the website. So you're not expected to know or absorb or write down all of the information. I do encourage people to definitely, take notes throughout or write down any questions or concerns that might come up. As was mentioned before, I'm going to kind of split the presentation into two different pieces. So we're going to take a break about halfway through and do a little bit of discussion and see if there's any questions there. And then we'll keep moving on and have some time for questions at the end too. So I am going to ask people to stay on mute for now, and we'll take some breaks for questions throughout. I'm going to start by briefly introducing rehab psychology overall. Some of you may be familiar with this type of provider, and some of you may never heard it before. These are psychologists who are specially trained in medical and rehabilitation populations. That is, people who have experienced medical trauma, injury, disease, or otherwise disorder, and often have concerns related to those experiences. In particular, today we're catering to people who are adjusting to life after brain injury and the many changes that can entail, including to one's body, how you may think or feel, abilities or functions, or socialization. Rehabilitation psychology practices are often related to creative problem solving, and again, how to adjust and adapt to these changes in your life and your experience. I will also plug in that right now there are lots of virtual services available too. So oftentimes you can do it from the comfort of your own couch, which is nice. I'm going to talk a little bit briefly about, there's two primary services often provided by rehab psychologists that are particular to people with brain injury. The first is a neuropsychological evaluation that might focus more on cognitive concerns, but also integrating psychosocial impact, as well as providing recommendations and feedback particular to functional goals, like going back to work or school or driving. This is a limited treatment and is usually informing a specific question, like returning to work after an injury. Psychological intervention, on the other hand, is more of a therapeutic process focusing on coping and adjustment after injury, and perhaps creating change or addressing some areas of concern. There are multiple different treatment processes, and it often focuses on patient-centered goals, meaning what the person is looking for and hoping to address. This can be offered in a variety of settings, including individual or family or group sessions, and as I mentioned, now virtual. And can be more of a brief or a long-term course of treatment, meaning a couple of sessions to 20 sessions. Rehab psychology can address in counseling in particular a number of different topics, and I have a whole long list here. I'm not going to read through all of them. Again, there will be the slides available online. For the purposes of today, I'm going to highlight some of the common ones, including mood concerns after injury, like feeling more depressed or sad or worried than usual, interpersonal or relational impacts, changes to one's thinking abilities like focus or memory, the experience of trauma, whether it's related to injury or not, communication issues that may arise, sleep, pain, substance issues, sexuality and sexual functioning, as well as family education and support. I do have our phone number in the right-hand part of the screen there. Feel free to copy that down. I will say that sometimes people do require a referral from a provider in order to engage in services. We do accept self-referral as well. If this sounds like today something that you'd be interested, feel free to call. Although your insurance company will typically determine whether you can start on your own or need a referral from another provider. But that's easy. You just ask any physician or primary care provider you might have. So getting into the meat of it today, I'm going to start by reviewing some general terminology and some terms that I'll kind of use throughout today. When I'm referring to the term sexuality, this is often more of a broader umbrella-like term, meaning it's typically pretty all-encompassing. This can include the impact to relationships, attraction, intimacy, sexual behaviors, or changes after injury. Sexual functioning is often more specific and characterized by the impairment or preservation of sexual function after injury, such as lubrication, orgasm, and arousal, and is typically related to the sexual response cycle in the body. After brain injury, there can be an impact to both of these areas and is often dependent on a number of variables. I have a couple of listed here. So for instance, is traumatic versus non-traumatic brain injury. And maybe you've heard these terms before, but I'll briefly review. Typically, a traumatic brain injury is caused by an outside force. A non-traumatic brain injury is usually caused by something internally, often a stroke or an aneurysm or something that might cause an impact on the brain. The location of the brain injury can also be specific to the type of issues that one might experience or changes after their brain injury. Depending on the part of the brain that is impacted, as you notice in that picture there, there's 4 different lobes of the brain. And depending on where that impact has occurred, can create different sorts of changes based on what that part of the brain functions and how it impacts the body or other areas. Severity of brain injury as well. They can be categorized into mild, moderate, severe, as well as the disruption of different systems like the neuroendocrine or neurochemical systems as well. So these are all things to keep in mind and are things that you may or may not know about your injury. And I would encourage you that if any of these things seem unfamiliar, to follow up with your provider and maybe ask some questions to get to know what type of injury you may have had and how that could potentially impact you, or as specific to sexuality or sexual functioning. So first, I'm going to talk about some of the direct impacts to sexuality or sexual functioning from brain injury. So these are related to the direct impact of changes on the brain itself, the brain structures, the brain systems, and how that can impact sexuality and sexual functioning. I have these kind of categorized and clumped into some different sections as well. So that first blue bubble you'll see there is primarily related to sexual functioning, as I mentioned before. This is the body's response cycle, things like arousal, erection, lubrication, and orgasm. It can also impact areas related to behaviors, which is the other blue bubble here. Frequency of sexual behaviors, the experience of hypersexuality or increased drive, verbal or behavioral disinhibition. So kind of that lack of filter that can sometimes occur either verbally or in our behaviors, as well as engaging in certain sexual behaviors versus others, given that sexual behaviors are very wide and broad and varied and can include things such as intercourse or not. There are also some other areas to consider in terms of disruption to menstruation, fertility or reproduction, both in males and female body people. And lastly is the quality or satisfaction of people's experiences and how they perceive or feel that their sexuality or sexual functioning has been changed. Next, I'm going to review some of the secondary changes to sexuality or sexual functioning. These are often some of the barriers that people encounter when they are trying to participate or engage in things related to sexuality. This can include bodily changes and how Things such as pain or positioning, bowel or bladder care can impact sexual functioning. It can also include medication effects or substance use, as well as things like psychological changes, including mood, sense of self or self-image or body image, as well as cognitive changes or changes to one's thinking ability, including the ability to consent to sexual behaviors or communicate. Also worth naming that there are various pre-existing issues or other comorbidities, meaning other medical issues that can happen simultaneously to brain injury or may have been there before, that can also cause impact to sexuality or sexual functioning. So for instance, cardiovascular health, things like blood pressure and blood pressure medications, as well as diabetes, are known to impact these areas too. So considering what kind of things might even cross over with brain injury and cause some of these concerns. And last but not least is also the psychosocial impact or the relational impact after injury. We're going to talk a little bit about that in more detail. There can be a number of different relational changes after injury and how a person and their relationships are impacted. So for instance, I mentioned that adjustment process and adapting to all of the changes after injury. Not only this can impact the person themselves, but also their partner or their family system as a whole. Something that can often come up with folks, particularly in the more acute stages after injury, is if you have a partner or loved one that might be providing some assistance or cares that may or may not have been there prior to the injury. And often this can be related to some role changes. So for example, if you were the person who used to do the finances of the household or take out the trash, and now that might, those responsibilities might fall on a partner, that can create some differentials and some differing role changes. Similarly, people will sometimes bring up changes to gender dynamics. So for instance, I've had people talk about their beliefs in terms of what it means to be a man, what it means to be a woman, or what it means to be the gender of your choice, and how that can influence one's relationship and one's perceptions of themselves as well as others. Changes can also include feelings of intimacy and closeness, and that could be increased or decreased. Sometimes people notice that they feel more intimate with their partners and more close after going through the experience of a brain injury. Some people feel like there are some strains or stressors that weren't there previously that can cause some concerns in those areas. Also mentioning the role of communication. This can be directly related to the impact of the brain injury if that created some changes in language or speech functioning. This can also be the role of communication more so in terms of those role changes. If you have a partner who may be assisting with some of your self-cares, it requires a bit of communication in order to navigate your needs and how you would like things to go that may not have been there in the past. Also identifying, also identifying the role of comfort or stress in the relationship and how this may be impacted after injury and how this may change over the course of injury, whether it's initially after injury or later down the road. More specifically, talking about dating after injury for people who may be unpartnered and seeking a partner after having had a brain injury. This can be thought of more broadly in terms of socialization and community participation, you know, wanting to be an active part of the community, have a social life, and engage in those behaviors. And then can be more specific to dating itself, of wanting a more romantic partner or that intimacy as mentioned before. Questions that often come up are about meeting new people. How do I go about finding a partner or meeting somebody that I could be potentially interested in dating? I do think we live in a very virtual world at this point, and a lot of different resources may, or means of meeting people may be through, you know, an app. But I think there's a number of other ways to become integrated or meet new people as well. And I believe that's going to be discussed a little bit more next week. Something to consider is also the role of disclosure. Disclosure is generally defined as disclosing or describing or identifying yourself as a person with X medical condition. It could be brain injury, it could be something else. And this can come up in a number of different ways after injury. And here I'm particularly talking about the role in relationships, and particularly new ones, people who may not be familiar with your history or be aware of your history of brain injury. People often bring up questions about if I should let somebody know, when I should let somebody know, how should I let somebody know? And that's a very personal decision dependent on your own comfort levels, as well as what your goals are in that situation. And this is something that can be brought up quite frequently. More specifically is communicating about any post-injury sexuality changes, how to address this with a new partner, when to bring it up, how it may be helpful, and how to navigate some of those waters when there's not an instruction manual for it. Another area of consideration can be balancing self-care and caring for another. If you're continuing to have a number of medical appointments, for instance, and how to navigate your own needs as well as the evolving needs of a new partner. And of course, all of this may be recently more complicated given the COVID pandemic and how that may have changed the dating world, as well as people's abilities to socialize given their own comfort levels too. So I've given quite a bit of information so far. So this is where we're going to take a little bit of a time out here. I've got a couple of key points to summarize what has been mentioned so far. And I want to welcome this as an opportunity for discussion or questions or concerns that come up. So I think oftentimes with the experience of any change, but particularly some of the changes after injury, can bring along a bit of anxiety, a bit of unsureness or uncertainty of how to address things, as well as the anticipation of potentially something going poorly, given past experiences. I think that this is something that could be addressed in a number of ways, both individually as well as with a partner. This is something we very commonly work on in therapy with a rehabilitation psychologist. There are different strategies or tools, not only to address anxiety, but also how to understand some of that anxiety and where it might have developed. For some people, the anxiety is something that maybe was always there or was always lingering. For some people, it may be a totally new experience after injury and related to some of the changes in their life. So getting to know a bit of yourself better, some of your own patterns, and then how to potentially address those patterns, as well as how those patterns might be interplaying with a partner, and equally understanding that a partner could experience some anxieties as well. So mood changes are very common and often a part of this adjustment process that can be addressed in a number of ways in a counseling setting. Absolutely. I think that mood changes after injury can present in a number of different ways. They can present as, very clear, typical ways that we would expect anxiety or depression or tearfulness. It can also look like irritability or frustration or anger, frustration with your body or thinking or feeling, not wanting to be the way you imagined it or hope it would be. It can also present as guilt. And I think that this can guilt or shame or embarrassment too. And I would say that that could present potentially on both sides of a partnership, whether it's the person after injury or their partner as well. Something that is common after injury is also a term called perceived caregiver burden. What this basically means is a person's perceptions that perhaps they're putting a lot more on their partner, or their partner has differing or more responsibilities than typical, and having some sense of guilt or worry or anxiety about that. And this is something that a lot of patients experience and have to navigate with their partners. And oftentimes talking with their partners about that experience is important too. Okay, so oftentimes with right-sided injuries, some of the characteristics can be related to, depending on what lobe it is in, can be specifically related to attentional processes or disinhibition or dysfunction, particularly if it's more in the frontal lobe area. If it's more towards the back of the brain, you can also have more visual spatial issues as well. I think where this comes into play is oftentimes with cognition and thinking abilities. That can vary as well across the course of the injury too. In the more immediate injury where it can be more severe, sometimes things may clear up a bit. So for instance, for somebody closer to injury who might be hospitalized and in an inpatient rehabilitation program where they're learning a lot of skills again and learning how to compensate, somebody with a right-sided injury might have a lot of attention and cognitive issues and changes to thinking abilities. Something that I've been asked before is how somebody may consent to sexual behaviors, of how a person can adequately communicate with their partner given some of those thinking changes, and how that can impact the relationship. A left-sided injury is probably more likely to impact language functioning in particular. And a left-sided injury often can disrupt communication processes. And that's another area where patients and their partners may need to deal with and address as communication continues to recover and evolve. Might require a number of compensatory strategies. So for instance, sometimes people can respond better with writing information or responding to yes or no questions rather than more complex information. So sometimes it's about finding compensatory strategies to work with some of these concerns as they may continue to improve. And until we know what the full picture might look like, as we know that recovery from brain injury can take a long time, and many people experience improvements for upwards of a year after injury. Yeah, so even if you do currently have a partner, just imagine what that might be like. I think there's probably some pros and cons to it. I mean, it's probably convenient in some ways, and probably challenging in some other ways. I think that there are probably some considerations as well in terms of things like safety, when to take it from virtual to in-person, how to communicate with somebody online. For some people, they might find it helpful that you get to message back and forth a little bit first. There may not be as much pressure to respond to a conversation, and you have some time to kind of think through and plan out how you're gonna turn that into a pickup line, right? So I think that there's some differing perceptions there, and some benefits and also drawbacks. I think in a time, particularly right now, people are becoming a little bit more virtually dependent too, especially related to the quarantine. I saw a commercial for, I think it was OkCupid recently. It was kind of interesting, and it was saying throughout the commercial, it's okay to be interested in somebody that you've never met before. It's okay to be unsure about what you're looking for in a relationship or being undecided. It's okay about exploring different avenues and not knowing where things are going to go. And I think the virtual format can allow some flexibility in those ways too. I will say it does make for ease of access in some ways too, knowing that everybody on that app is there for probably a similar, somewhat similar intent as yourself too, versus, you know, going into a more social domain in person, probably have to ask, you know, or is the other person in a relationship or are they seeking something? So there are definitely some benefits and there's some drawbacks too. I think that sometimes the apps do not cater to people with disabilities or people with difficulties with vision or language or so forth in terms of using their technology. So there are lots of considerations, lots of benefits, and some cons as well too. So when it comes to relational or sexuality changes after injury, people often wonder, where do I go? How do I address this? Who might I talk to? And there's a very team accessible approach here. You probably have met with a number of providers, and I'd say almost any of them are totally appropriate to ask these questions to. So I have a whole list here of how people may be potentially useful for you. And if they can't assist in that area, they'll probably direct you to somebody who might. So for example, if somebody came to me as a rehabilitation psychologist and it was about sexual functioning, we might have some ways to address it, but I might also want you to consult with a physician and talk about some medical treatment approaches too. So usually we work together as a team, and I would encourage you to seek out the provider you feel comfortable with as long as you're getting your needs addressed. I have here a list of questions to ask your provider that can help kind of get the ball rolling here. I do think that oftentimes the responsibility does weigh on the person with brain injury side of things in order to convey or communicate some of these concerns, especially related to sexuality and sexual functioning. It's not always a topic that gets asked about in treatment settings. So making sure that if this is something on your mind, that it is really important to bring this up with your provider. And I have a list of questions here that might assist you in terms of how to bring this up, or what are good questions that if you look at this list and are wondering the answer, that would be a good indication to ask your provider. Again, I'm not going to run through this whole list together here. It will be available for you, but just to mention a few, going back to those first slides about where's my injury, what part of the brain was it, and how could that potentially impact me? Is there a potential, you know, going through my list of medications, do any of these have an effect on sexual functioning? Are my changes expected to be chronic or long-term, or am I in a period of recovery where I may resume some of my abilities that I'm concerned about right now? How can I become more informed, or what resources are available to me or my partner to learn more about the impact of my injury on sexuality and sexual functioning? And then I'm going to boil this down even further and talk about the role, as a rehab psychologist, talk about the role of areas that people often bring to me or that can be addressed by a rehab psychologist. Sometimes it depends on the person's comfort of they may have some concerns in the back of their mind, but feel really uncomfortable talking about it, especially with the provider and maybe on the first time that you've met them too. And it's not unwarranted to say, yes, I do have some concerns, but I'm a little uncomfortable. I'm not sure I'm ready to talk about them yet. Okay, let's see if we can build up our relationship first. And if you continue to have these concerns and feel comfortable, maybe we can find some ways to address that discomfort, or maybe even a broader role of discomfort or anxiety that might be acting as a barrier here. Some patients present with, I've had these changes to my body. I'm worried I'll never have a sex life again. What is my life going to look like with this injury? I feel uncomfortable discussing this with my partner, or my partner doesn't seem very receptive when I've brought it up before. It's just not going anywhere. What can I do? I've lost my interest in sex. It may not be about the functional or the bodily response itself, but I just don't feel like it right now. Is something wrong with me? Or how can I address this? Or is it related to the fact that I'm just feeling generally overwhelmed or more tearful than usual? I don't feel sexy anymore. My body doesn't feel quite like myself, and I've had a lot of changes since my injury, and I don't know how to regain that feeling of feeling sexy again. Or I'm worried about the impact of my medical issues on my partner, or my partner who's providing cares for me. In particular, if you have a partner who might be providing bowel or bladder or self-cares, this can be something that people feels like impacts their sense of self, their security, and their ability to feel sexy, and how that could be potentially addressed and increase that comfort with their partner. I'm also going to briefly mention some helpful strategies that could be addressed with one of your providers, even in rehab psychology. The first is, you may have noticed several of them I brought up are perhaps not related just to sexuality itself, but also levels of comfort, that having variable levels of comfort is totally normal. And how can you help to get over that hump before even addressing some of these concerns? Or the role of communication, particularly in a partnership. If you have a partner and are wanting to communicate some of these concerns, or have a new partner, the role of communication can be important, both related to expectations or preferences, as well as bodily reactions and what might work or not work for you. Exploring different means of arousal, different uses of visual, touch, imagined information, as well as different erogenous zones. Now, that word basically means the different parts of the body that may be more sensitive to becoming aroused or feeling intimate. There are also different brain pathways that are responsible for how different information is processed and how the body reacts to it. So there is potential that your type of injury or injury-related factors could determine what types of visual or touch or inputs might be more successful for you. Varying the sexual repertoire, meaning what kind of sexual behaviors are typically conducted in the bedroom in your case, or what are preferences, or are there certain aspects that might be more helpful than others, and how to kind of get to know your body again and how it may function and what types of behaviors might be more successful for you. Also, the use of adaptive equipment and things that might be helpful for you, including lubrication. It's also important to know things like the types of lubrication that might be useful for you. So for example, water-based lubrication is a really common one, and is most successful if you're using particularly things that are silicone versus the use of silicone-based lubrication that could destroy a toy that's made of silicone, and what sort of things might be more useful for you. Luckily, either are safe with condoms, I believe, but that would be something if you use condoms in your sexual activities as well. Another consideration is the use of assistive versus adaptive devices. Usually assistive devices are different sorts of things that are going to help you with sexual functioning in particular. There are medical devices that can be, I believe, prescribed, quote unquote, and are typically utilized to stimulate orgasm. But quite frankly, these are probably going to be very similar, and probably going to be cheaper to go to your local sex store and use some devices that might help stimulate arousal and orgasm as well. Adaptive devices, on the other hand, are probably more compensatory in nature. Things to help with positioning. As you see, I have some pictures on the right-hand side here, and help to address perhaps some of the secondary barriers that may interfere with sexuality. Some other considerations are safe sex practices. So for instance, if somebody has some motor impairments, difficulties with fine motor dexterity, or how it could impact the ability and the use of your hand, that might impact the ability to participate in sexual behaviors or things like putting on a condom, and is something that could be a goal work towards, or figuring out how to compensate or address some of those concerns. And last on this list is the use of a home care attendant. So most people do not realize that if you are using a professional service to have home cares, that, you know, basically on the job description, this can include having an assistant to help you with sexual activities. So for instance, having your home care assistant help with putting on lingerie before engaging in sexual activity with your partner. And this is something that can be part of a formal professional relationship and is not always thought about or just aware about. So sometimes how to consider some of those, how to consider that professional relationship, how it could be used, how it could be comfortable for you. And again, making sure that your home care attendant is aware of this, that it's part of their job description and is comfortable as well. I also wanted to highlight in this bubble here, I have a resource on the next page with the link called the Pleasurable. And this is kind of a manual particular for assistive and adaptive devices with people with disability. And I have a bunch of different links here. So I don't know if you can see the second bullet on this page here, the Pleasurable manual. There's also a list of different links here on several different topics. And again, our phone number for rehabilitation psychology services. If something spiked your interest today and you feel like we could be of assistance to you, please give us a call and let us know how we can set that up for you.